And go ahead, Charlotte. Thank you.
Okay, good afternoon and welcome today to our webinar on carers and COVID, your questions answered. Thank you for joining us today. I'm Charlotte Dick and I'll be chairing the session. So today we aim to start, we've made a slightly later start. We will be finishing at 3 o'clock. We've got 6 lovely speakers who've presenting today. And we'll have a 20-minute Q&A, so please do save those questions and put them in the chat and we'll answer them at the end. So I'm one of the directors at Black Women in Care. Black Women in Care was founded by Ollie Yinka Thomas, and this was to influence all the challenges around discrimination within health and social care, supporting Black women, and to help them work up this within leadership within health and social care field and throughout our community. So apologies, there has been some minor changes for today's programme. Unfortunately, Nikki Kanani was unable to make us today, but we have the honour of having Dr. Adrian Hayter from NHS England with us here today. So Dr. Adrian Hayter, he is the Clinical Director for Older People and Integrated Person-Centred Care at NHS England. He's a GP partner at Runnymede Medical Practice, and Adrian has been busy going to care homes and vaccinating residents and staff. We've also got Dr. Donald Palmer. Thank you for joining us today. He is the Associated Professor of Immunology and a member of the British Society for Immunology. So Donald was the Secretary for the BSI London Immunology Group between 2002 to 2007, and previously a board member of the BSI Council. He is currently on the editorial advisory board for immunology. That's going to get me today news. And he's also a member of the British Society for Research on Aging. So we will also be joined today by Wendy Oliyewala, who is a midwife and a National Equalities Lead for Midwifery in England and NHS England. So her role is to help improve the health outcomes of mother and their babies from Black and minority ethnic groups. So anybody who's, I'm pretty sure, has got any questions around fertility, etc. with the vaccine, it'll be good to ask Wendy those questions. We've also got some wonderful Black Women in Care members today. Ntombi Ndweni, she's a nurse case manager and assessor at JC Michael Groups. We've also got Tina Egbon-Mali, who's Answer Care Limited Director, and we're joined by Fola Olinio, a registered manager at Immaculate Care. So before we get started, just a few housekeeping rules. So this is a webinar. You won't be able to unmute yourself until the end when we have a Q&A session. Please do bear in mind that this will be recorded. So if you do have any questions that you don't want to be identified, please do feel free to email us at Black Women in Care. We can get those questions answered for you. We'll leave the information in the chat box at the end. So thank you for all of our panel for attending, contributing. So we will get started with the first person on the agenda. So Dr. Adrian Hayter, if you'd like to make us welcome, and thank you for joining us today.
Thanks very much, Charlotte, and it's a real privilege to be with you today. And I think the important thing is that we are continuing this conversation around vaccination. So thank you very much for this opportunity. It's a conversation which needs to keep on happening, and this is one way of being able to deliver that. So thank you to all the people who are attending, and to my fellow speakers as well. Thank you to all the care workers and who've gone through this kind of stage of this pandemic, and we're getting to this stage now because I know how difficult it is. And as you said, Charlotte, I'm a GP and I've been working here, and part of my week is going into a care home twice a week. So on a Tuesday and a Friday, I go into a care home every week. I've also got the role in NHS England, working very closely with Nikki Kanani, and we've been working on the vaccination programme, that important programme that has undoubtedly saved lives, both of individuals and those who receive care. So it's been my privilege to be able to work on both sides and be able to support both the vaccination programme, but also be a frontline worker. I also know that my thank you is not a hollow thank you as well, because my mum worked in the NHS. She came over probably around the Windrush generation time as a nurse from the Far East and to help with the NHS. But actually, the latter part of her career was working in care homes, and she was really dedicated to her work in care homes. So she's in her 80s now, but she'd love that I was on this webinar now to presenting with you. So really, I understand where the care sector is, and I understand how important it is that we reach out and work together, the NHS plus the care sector, to be able to answer questions and to be able to support each other in this important work. Quickly, I just wanted to tell you the story that I see around the pandemic. I first came into contact with COVID in the care home that I go into. And it was a nurse called Kelvin who, in March 2020, who, as I was going around to see some other patients, he was quite vigilant, and he said to me, "You wouldn't mind seeing this lady who has a rash on her legs." And Kelvin had been at the home for a year or two, and he had identified a peculiar rash on this lady's legs. I went to see her, and when I pulled back the covers, she had a mottled rash, and she was looked well when I looked at her from the end of the bed, but actually the mottled rash showed me that she wasn't getting enough oxygen into her body. And I took out my pulse oximeter, and her oxygen saturations were really low. So if it wasn't for Kelvin, we wouldn't have known that this lady was unwell because she was sitting in bed without any distress, without any respiratory symptoms at all. And this was in March 2020. We were able to talk to her family. She stayed in the care home, and she died about 24 hours later, but the family were able to see her. So that was my first encounter with COVID, and you will know as carers, you know, what happened between 2020 and 2021 in terms of the work that we had to do, not only in care homes, but with domiciliary care as well, going into people's homes, how we had to protect ourselves, how limited the resources were to be able to support us and the people who are vulnerable and that we were caring for. So that then brought us to the vaccination program, and back in September, October of 2021, we were then getting the understanding that we had a vaccine really ready to deliver. And so Nikki and myself and other people in NHS England really kind of thought about how to design that so that we could vaccinate priority groups, and care staff were front and centre with the NHS in those priority groups, together with the vulnerable in care homes. And once again, I went to we created a way of vaccinating with at the time the Pfizer vaccine, and we designed the program to go into the care homes. Now, we designed that program and we tested it out, and Kelvin, in December, when I went to vaccinate, he said to me, "I'm not ready to receive the vaccine. I don't want to have the vaccine yet." And we respected that. He was offered the vaccine when we went in to do the care home, and we respected that decision. And it started a conversation that I had with Kelvin for a few months around the vaccine, around his preparedness to have the vaccine, around the information that he wanted to have the vaccine. It was a really important conversation for him as an individual. And eventually, he decided in his own time to have the vaccination, and then subsequently caught up with the vaccination schedule. And Kelvin is an example of how we should be supporting each other in the right way with questions to be able to understand and be ready to receive the vaccine, which is why today is really important. We get to today and we've had a year of vaccination and been able to prioritise the vulnerable groups. And really, in terms of the vaccination programme and how we've reached out to people, it has been a success, but we want it to continue to be a success in terms of reaching out to everyone and giving everyone the right information. You know, we've had just in the booster vaccination for this autumn campaign, 15 million vaccine boosters have gone out in this part of the campaign. In terms of the whole campaign, 142 million COVID vaccinations have been given already. So we've also got an evidence base behind the vaccination programme, which we know we can rely on in terms of looking at all the side effects and safety and other things. So what I wanted to finally make the point about, Charlotte, is the fact that this year, I think we're facing two threats. One is the COVID threat, and we know that the rates of COVID have gone up and then it's come down a little bit, but it's likely to go up again very soon. And the second threat is that we have the emergence of flu. For the very first time in the last couple of years, we've got flu. And what we learned from the early part of the pandemic was that flu and COVID together, for the first part of the pandemic when we didn't have vaccinations, flu and COVID together can be a lethal combination of respiratory virus. And that can affect people in more than an additive effect, a synergistic effect in terms of how they affect people. So this time with the autumn campaign, we want people to have both booster for COVID and their flu vaccination, if at all possible. And that's what we've been doing with care home residents. I had both my vaccines done, one in each arm, absolutely safe. And this new autumn vaccine is a bivalent vaccine. It has the two variants, protection from the two variants in it. So it gives us the protection against the current kind of COVID strains and also flu. So that's my plea to everyone, is to really consider it carefully. We can answer your questions. I'm here to help. So please ask them of me, but also of your own GP or other people. We are here in the NHS to help. I'm going to hand over to Intumbi, I think, who's going to really kind of follow on and tell us about My Day, My Choice.
Hi everyone, my name is Ntombi Ndweni. I'm an case manager and assessor from JC Micro Groups, and I have prepared a short video just to tell you about my day, you know, when it can be varied, and the video will follow on soon.
Sonia, sorry, I'm in a meeting at the moment. Is everything all right? Mm-hmm.
Thank you. So yeah, that was just the rundown to my day, and I will hand over now to Tina, who will be sharing part of her story as well, her day.
Yeah, hi. So issue suddenly. Can you hear me though?
Yes, we can hear you, Tina. Please go ahead.
Oh, okay, yeah, that's better. My name is Tina Ebonimale. I am the registered manager and director of. I want to talk about my day. Early in the morning, I wake up around 6 o'clock. Do my prayers, do some meditation, reflect on things. If I have time, I'll read the newspaper, then go to the shower by around 6:30, take my bath, get ready for work. Then I have a little daughter, she's 4 years old. I have my mom who is 76 and she lives with me. I'll help my mom to support my daughter because she's very acquainted with my mom, support her to get ready for school. Then we leave home by, I have no time to take tea or coffee. It's just rush, rush, rush. Then we leave home by 7:30, hit the car, take her to school. She starts school 8 o'clock. Then I'll meet with the teachers. I'll meet with the, other people in school. Then after that, then I head to Costa to get, I love my chocolate, to get me up for the day, grab hot chocolate on the way, get to the office by at least 8:40. We actually start 9, but I like to get there before everyone else. When the team comes in, we have a meeting. I meet with the domiciliary care team. We run recruitment agency and dom care. So I also meet with the recruitment team as well to set out the day. Now, most of my typical day, like today, as you can see, I'm wearing a uniform. I work as a carer. I can jump out if a carer is running late. I will step in, go get the job done. I can have countless people coming to the office for various reasons. They're there to take gloves, to take apron, or for supervision, or to meet with Tina, or for registration. We have open door for everyone to come in. Then I can have family that want to meet with me. So I have contact with countless people in a day. Now we deal with vulnerable people with learning disability, physical disability, older people. We also deal with young adults. Sometimes I go out to meet with my clients, to have meetings, sometimes to get feedback of how we're doing. Now, I can be that busy and even forget to have lunch. Fast forward to tea call. I could be meeting and meeting, catching up with emails, catching up with messages, dealing with issues that need to be sorted, dealing with the local authorities, dealing with CQC. It can be endless. Now by 4:30, I'm back again to my daughter's school to pick her from school, whereby I will meet with other children, meet with parents who have a child, meet with the teachers as well to get feedback of her day, take my daughter home. Sometimes I have to come back to the office or stay home. We get home most times 6 o'clock, get the assignment done and all that. The whole of my day, I meet with vulnerable people, I meet with older people, I meet with children. I am vaccinated. I'm double vaccinated. I have my booster. I have my second booster. I've just booked for the third one. I have to protect my mother. I have to protect my child. I have to protect my clients, my staff. We test countless time in the office. We always testing. If anyone is coughing, you test. If you're sneezing, you test. If you look funny, you test. We just test. We just want to make sure, we are safe and we're not passing anything to our clients and the people around us. It's very important thing for us in the care industry that we get tested. Within our industry, within Answer Care, we are, as at yesterday, we were 98% vaccinated, and with the jab as well. We just encourage each other. If that person has not taken, we try to encourage each other so that we get vaccinated, we get the booster. That's it, women. Very busy. I'm going to hand over to Dr. Donna Palmer to tell us a day with the virus. Thank you.
Thank you, Tina. You make me want to go out for a hot chocolate as well. Thank you, Charlotte, and thank you to the team and others for inviting me. I have to say, I'm rather humbled, and I feel a bit of a fraud because I don't work, as you probably gather, in the NHS. I'm just a basic immunologist. So I thought I better give you some legitimacy, I hope, of why I'm in the presence of such wonderful and awe-inspiring individuals. In why I'm here, and hopefully to answer any questions. So I'll just speak a couple of minutes, partly about the life of a virus. But before I do that, I thought I'd just say, so I live in Brent, and you probably are aware that, Norfolk Park, there's two stories. Norfolk Park was one of the first hospitals that went into emergency measures with COVID. I did my doctorate there. Both my daughters were born there. But moreover, there's a street in Harlesden called Church Road. I get my hair cut there. And 40 folks on that road died of COVID. And what was also occurring at that time, some of you may remember this, so we're talking over 2 years ago, was when COVID was around. Maybe some of you will remember. There was a sort of a messaging or an idea going around that COVID wasn't going to impact on Black people. And some of you may remember that. I definitely remember that. And what happened then, sadly, is we saw the situation of disparity. And then I was approached by folks in the community who were unclear of what was going on. There were clear concerns they had, and they just wanted some clarity. What is a virus? How does it work? What is it about vaccination? What is it about immune system? And as an immunologist, and someone that's been publishing and working and teaching immunology for a number of years, I was asked to provide some information, and that's all I'm doing. I don't get paid. I do this as part of, I think, of giving back to the community, and it's really about just having the information so you can make an informed choice. So I'm not pro or against vaccination. I'm basically an immunologist, and as I said, I've been studying how the immune system works, and particularly, as in the introduction, you've heard that I'm on the membership of the British Society of Aging, and one of the things we know is that as you get older, your immune system gets weaker, and I've been studying that for a number of years. And the reason why viruses in particular are pretty sort of nasty creatures in terms of our bodies is what viruses do is they get into our cells, and when they get into our cells, they literally will just destroy our cells. They hijack it. Think of it a bit like, if someone's coming to your home and just ransacking it, then going to another house and ransacking it, causing destructions wherever they go in. That's how viruses work. And the key thing about what our immune system is, our immune system, imagine again, another scenario is at a club, and you normally have, you know, the bouncers are at the door. Our immune system is a bit like the bouncer. It won't, you know, it will prevent, you know, unsavory characters from getting in that can cause a destruction. And the problem that can sometimes occur, particularly with age, is that the bouncers may not be present. The bouncers may be slightly weak. So what's really required is, for this scenario, is that we want our bouncers to be equipped. We want our bouncers to be able to identify, you know, those that are going to cause harm. And so what vaccination is in general, scientifically, and then we can have Dark's questions, is what vaccines do overall is that they train our immune system so that when a virus does now appear into our bodies, our immune system can act quicker and greater to remove that threat. Vaccinations don't stop you from getting infected, so it's really important. What it will do, in the majority of cases, is it will lower the severity of disease. And the last point I'll raise is, as an immunologist and been studying how the immune system works, realizing the immune system is really important for survival, not just humans, but for all living organisms, but particularly in the humans, and the fact that we are living longer. And my mum, who used to work in the NHS as well as an auxiliary nurse, is now retired and lived in the Caribbean. And one of the things of us living longer is for two reasons. One is to do with public health initiatives around clean water. But the second reason of why we are all collectively living longer is around medicines, and in particularly vaccinations. Those two are key areas of public health that is actually, you know, I mean, folks may remember. I mean, I was talking to my mum, she's in her 80s. We'll remember diseases like scarlet fever, diphtheria, whooping coughs. You know, those diseases practically gone. You know, some of those were like childhood diseases. But through vaccinations and whatever, they're very rare. And that's really proved, you know, really important. And for many of us, that we're sitting on the comfort of actually having our parents or grandparents making sure we got our childhood immunization so that, you know, those childhood diseases no longer occur. So I'll stop there. I believe that the next person on the call is Fowler. But again, you know, thank you very much for allowing me to speak to you today. Thank you.
Yeah. Hello, good afternoon, everyone. My name is Fola Oloniyo, and I'm the Registered Care Manager for Immaculate Care. Immaculate Healthcare Services has been in existence for over 22 years, and we are largely one of the biggest care provider within the London Borough of Croydon, and largely a Black-owned company with 99% of care workers here being Africans. And I remember vividly in March 2020, when the COVID thing was at the peak, the carers, everybody were told, okay, protect yourself. And all the carers had this myth, which was being passed around, like Dr. Palmer said, that COVID would not affect Black people. And most of the carers have already made up their mind that, okay, it's not going to affect them because they'll continue to eat ginger and garlic. And we went on thinking about the fact that we are domiciliary care providers, and we have well over 300 clients within the borough that we are in. And we have to go from home to home. And we were looking at the cross infections with people walking. First of all, what we did as a provider was ensuring that carers do not work in different geographical areas at that time.
So we decided to group all carers. If you stay in the south of the borough, you can only walk in south of the borough. The people in the north will only walk in the north borough. So that at least we know we have been able to reduce, cross infection within the client's home or within the carers, which we did. And by the time they came out with the COVID vaccination, almost all my staff came out to say, no way, they're not going to, it's a means to kill the Black people. And that became a very tough one for me to be able to lead them and guide them right to take away the myth. But what we all sat down to do in the management meeting was, how do we encourage all our carers, knowing fully well we have majority of Black Africans who have the myth that, they don't want them to be used as a guinea pig to try a vaccination that has not been tested on people. And well, coincidentally, we had one of our staff, which was on BBC, one of the care workers at the Croydon University Hospital, who was then admitted and contracted COVID. And she was at the verge, of the last days. And our appeal when they showed her on BBC was for all our other colleagues to please take up this vaccination as soon as it comes out. And we had to share the video. We now created a WhatsApp group for the whole staff where we passed on information, daily information about encouraging them to put on their PPE. Then the videos were shared with the staff. Still, some staff didn't want to do it. They needed some encouragement or, valid evidence to be able for them to take this vaccination. What I then did was to lead by example. So most of us in the office, the care coordinators and all team leads, we decided to start taking this vaccination. We did a video. I did that and I sent out to show them while they were giving me, because they said most people who have taken the vaccination died on the spot. So I took my vaccination, did a video while I was being, administered with the vaccination, and I put it up on the WhatsApp group. And before we knew it, all carers started doing the same. People doing the video and taking up the vaccination. And as at last year, November, we've had all 99% of carers taking up their vaccination. And now we're also encouraging them to go for the boosters. But the problem people bring up, and some of, especially the younger ones, is if I keep taking this vaccination, will I be able to get pregnant? Because there's one statistics they've seen out there that says that if you keep taking vaccination, you are bound, to have problems with fertility. And on that note, I would really like some explanation, and I'm happy that most of my staff have seen that most of the guests online, the attendees, are the carers from Immaculate Healthcare, and I'm so proud of them for coming. And on this, I'll hand over to Dr. Wendy Olayiwola. Thank you.
Hi, can you hear me okay? Hello?
Hello.
Hello, Dr. Wendy, we can hear you.
Hello, thank you very much for inviting me, and thank you, Fola, for handing over. It's such an honor to be here this afternoon. I think I've started answering some questions in the chat. So I only have about 5 minutes or so, and then I have great information to share with you today. I'm going to share my slide briefly, then we go into a little bit of conversation. The information I want to give to you is to empower you and to give you that knowledge to be able to make an informed decision. It's not to scare you at all. So take this information as this is reality of what the Black communities in terms of statistics when it comes to vaccination or COVID or pregnancy and all the fears and what Fola said about the myth that is out there that we have to keep busting. If you have the right information, that will really help you to make the right decision. So what do we currently know? in terms of pregnancy, in terms of our babies. And I want to really narrow it down to, please do tell me if you can see my slide. Can you see my slide?
We can see them. Thank you,
Fantastic. Wendy. I'm really going to run through this because there's a lot of information, and then I really want to end it with what we need to do and just reassure you. So the first slide talked about COVID, and as we know, when COVID struck, we are very much aware that, you know, the Black community were disproportionately affected. So during the COVID, following 2020, 55% of pregnant women who were admitted, you know, to the hospital with COVID were from ethnic minority background. And for out of 8 plus 4, 12 women that died, actually, sorry, apologize. Out of 8 women that died, 7 of them were from Black, you know, background. And Black pregnant women are 8 times more, you know, likely to be admitted to the hospital, and 4 times more for Asian women. And I'm sharing this statistic with you because it's not that it has changed. It can only change if we have this information and if we get ourselves protected. So moving swiftly to the next slide. Again, I don't want to take it on that many of us do know what Embrace is. Embrace look into maternity data of pregnant women and babies, even though for our babies and our mothers that are pregnant within our maternity system, the death rate is falling. But actually, it's not falling amongst the Black babies and Asian babies, especially amongst the Black. And if you're a Black woman, or you have a Black baby, or you're from ethnic minority, and you also lived in a deprived areas, you have a higher risk of having infection, or your baby dying, or you are dying as well in pregnancy. Again, this information are not there to scare you, but these are real words that we are living in. And we do know that in terms of our babies, if you are from those backgrounds that I have mentioned, your baby is twice more likely to be admitted in the hospital following birth, and then 4 times more likely for your pregnancy to end in, as stillbirth. So you may be familiar with these statistics in terms of the information of Black women 4 times more likely to die, and mixed ethnicity women, twice likely to die, or Asian women, twice likely to die. And that is still our reality. And how can we change this? So as I previously said, during the first wave, out of 8 women that died, 7 were from ethnic minority. And then during the second wave, 11 women died, which obviously 33% of those women again were from ethnic minority. And then in the third wave, out of 13 women that died, only 5% were known to be unvaccinated. So even though the disparities continue to widen, as said, the Black community are actually, at the bottom edge of that. So what can we do? I'm going to stop sharing now. So giving you all that information to know the risk that we are at the moment. So it is very important to know that when you're pregnant, especially those in the 3rd trimester, are at greater risk from becoming seriously ill with COVID-19, which obviously can cause complications for both you, the mother, and the baby. So when you become pregnant, your immune system weakens, which makes it harder to fight off any infections, regardless whether before even the COVID came. So if you're pregnant, your body is vulnerable anyway. So there's the JCVI, which is the Joint Committee on Vaccination and Immunization, and this committee advises the UK Health Department on Immunization, has advised that to maximize your protection against COVID, pregnant women should be vaccinated. This includes a further vaccine dose ahead of winter. Now we are in winter, and it is important that you protect yourself if you're pregnant. And when viruses circulate most and then can cause greater harm, and we know that with that winter, we always fight with flu, the whooping cough, and obviously now the COVID. So at the same time, the rate of flu and whooping cough vaccination during pregnancy are also lower than we have seen in previous years. So the NHS really encouraging and wants those who are pregnant and the families to have all of the information they need. So I've given you some risk factors and some information that is required for you today, about all the 3 vaccinations, the importance of the reason why we need to protect ourselves and those people that are around us, especially when you are pregnant or when you're planning to get pregnant, so you can make all the necessary informed choice. So as mentioned previously, the study also looked at, those admission, to the hospital with COVID-19 shows that there are higher risk of admission to intensive care if you're not vaccinated, with high blood pressure due to preeclampsia and premature or stillbirth that I've already highlighted there. So I'm here. I'm happy to answer any questions or any fears that you think you may have. I mean, I think it is very important that you connect with your general practitioner, your GP, you connect with your midwives, you connect with your pharmacist, because they are just perhaps around the corner. Connect with those professional groups, and within our community, connect with those nurses or midwives or doctors within your family as well. And I also heard some people mention faith, and I think it is important we mention faith because we are faith people. Black people are faith people. It is important. The Bible says, if I may quote it, that walk without faith is dead. So if you want that faith, you need to walk. Walk in that sense means get the information to protect yourself. The information you need to get is if there's a vaccination that you need to protect yourself. Prayer has its space. We can pray. Prayer has its space. Education has its space. Vaccination has its space. You cannot swap them. So I will leave it out there. Thank you very much. I think I should end this question time. Am I right, Nicole?
Thank you, Wendy. Thank you so much. What an inspirational talk. I just want to say a quick thank you to all of our speakers today. I'm feeling very much informed today. So we're going over to question time. Thank you so much for all the questions that's come up in the chat. Unfortunately, we won't have time to answer every single one, but we will have some opportunity at a later date, but we'll talk about that at the end. So the first question goes out to Donald. Can you tell us why it's important for care staff and the public to have their COVID booster?
Well, my fellow colleague, Dr. Adrian Hayter, has actually provided a really good answer. I guess, as he pointed out, one, your immune system gets weaker, but the real key thing to think about, one thing viruses do, they always keep changing. And I want to put this in context for folks to understand this. Scientifically, viruses will change their coat, and they're often given the Greek alphabet name. So you would have heard, you remember, the Alpha or the Delta variant. Now we talk about Omicron, and so most people may think, well, hold on, what's happened between D and O? Between D and O, there have actually been other variants. There's been the Epsilon, but it's come and gone. So basically, what we know what viruses will do is they will change their appearance every time. Now, the real problem comes is that our immune system is very, very specific. Our immune system will focus on a particular variant. And if viruses just changed a little bit, what your immune system was trained to recognize, it will no longer recognize the new variant. And I'm sure those of you who are over 60, 65 will be aware that's why we have to have the flu jab on a yearly basis, because flu changes. And this is something that viruses do. Compare that, for example, to the tetanus jab. The tetanus jab hasn't changed. The tetanus doesn't change. And often you require a booster maybe after every 10 or 15 years because the level of immunity has fallen. But often with viruses, you need to have that because viruses just change.
Thank you. Thank you. I'm going to ask my next question, if I can, to you, Adrian, if that's okay. One of the questions that we've had asked is, how do people get their COVID vaccine and their flu vaccine now? How do they get access to that? So if I'm a busy carer and I'm going around, I don't have much time, what would be your advice for somebody who is thinking about it?
Yeah, there's a really good question, because, you know, access to the vaccines is really important. So I think we posted in the chat kind of the national booking systems. So actually you can go online and then book it yourself and kind of book it at a time that's convenient for you. Obviously, there are lots of different places that are doing the vaccination, both COVID and flu vaccination. So often it may be a community pharmacy, and there's lots of community pharmacies which may be close to where you live, open a bit later, or open at different hours which suit you. Your GP practice, and my practice, for example, what we have done is got together with all the other practices and combined and offered the vaccination at a central site where people can have both the flu and the COVID vaccine. What we did was we got our flu vaccines and we got the COVID vaccinations from the vaccine sites, and we put them together so that people would have the opportunity to just do it once and have both vaccines at the same time. And then what we've also been doing is we've been running separate vaccination clinics for flu in the practice whenever we can, to be able to catch the people who just come into the surgery and want to have it done in the surgery because they can't get to the vaccination centre. And we've also had some of the COVID vaccine which we've brought along as well, so that we can offer people the 2 vaccines in one go. But so there's national booking, which I think is a really convenient way. If you've got a phone, or you can kind of go onto that on the website and book it. And then there's the local booking services through your GP practice, where they will be able to tell you if you're eligible for the flu and the COVID together. If you're just eligible for COVID, then you can get that done at the vaccination centre. If you're just eligible for flu, then you can get that done as well. So many different places to be able to access the vaccine. And then if you're in a care home and the care home is being visited by one of the visiting vaccination teams, and you're on duty and it's better for you to have it done there, then by just letting the vaccination team know so that they've got enough vaccine prepared, they can come out to you. So that happened in my care home that I look after, and we vaccinated some staff as well as residents on the day of vaccination as well.
Excellent, thank you. So no excuses really, there's loads of opportunities out there in the community, and I'm pretty sure there will be a link in the chat box, so please do look out, and if you have any more questions, please do type them in. So my next question is going to be for you, Wendy. Can we find out, or can you tell us, if somebody's pregnant, can they take the flu and COVID vaccine at any point throughout their pregnancy? And also, can you tell me anything about the whooping cough vaccine as well in pregnancy? That's been a question around the COVID, flu and whooping. Sorry.
That's okay. I think I heard the first question clearly. I didn't pick up the second, but let me go to the first. And if I should just repeat that, if pregnant women can take both vaccination at any time in the pregnancy, and the answer is yes, they can do, you know, and I think it is important. I think I did mention actually that, especially for those in their 3rd trimester, you know, if they can't take, in case if you do forget, but actually it is safe at any stages to take both. Before COVID vaccination, we've always given pregnant women flu and whooping cough anyway, and that still continues. So you just have another one to take, which is COVID, to protect yourself. It's like having the full force of protection, really, because they all have different, all those vaccination are focused and targeted at different viruses. So it is safe in pregnancy at any stage. It is also safe for breastfeeding mother as well as, you know, post pregnancy.
Amazing, thank you. Can I just remind everyone just to mute themselves if you're not talking? Can I also ask, the next question has come from someone in the audience who's asking, and this could be for you, Dr. Donald, or Dr. Adrian, why is it considered that Black African and Black African Caribbean people are more likely to suffer from COVID when infected? So
I could answer that, and then I think Adrian and well, it's partly, and this is where I think there's been this concern about the vaccination. I think what COVID has highlighted is, I don't want to sound controversial, but the data says this, is the existing societal inequalities. We've got to be open and honest if we are. And I'm very much reminded of this, and that's one of the reasons why I was wanting to speak. I was watching a documentary, but it's societal inequalities, both health inequalities, but also societal income inequalities. And I was watching a documentary about two parts of London and how they were coping with lockdown, Kingston and Harlesden. As I say, I live in Brent. And again, what you notice, folks in the community were having to work, whereas folks in Kingston could actually work from home. And that's and so what that meant was the fact that folks from diverse backgrounds, and you could see it in the NHS, they were the ones that were being exposed to COVID. You saw people who worked on public transport were the ones working, people working on the shop floor. And so we just have to be open and honest and say what COVID has highlighted, those inequalities. The other point, and I really want my medical colleagues to come on here, is the fact that given the potential disparities of comorbidities that also impact on our community, like diabetes, blood pressure, etc., and the health inequalities, COVID on top of someone has diabetes can really have an impact. And so it's those areas that I think is what the data shows. And so that's, for me, a really important issue is what do we do with that information going forward?
I couldn't agree with Donald more, and actually kind of I look at it, Donald, in terms of two kind of factors. I think there's probably a biological thing that we haven't discovered yet around immunity and kind of, you know, how we are. We know that often, and it's your area of expertise around aging. Aging does cause a change in how we are susceptible to some of these viral threats. So there is something biological about it, and we haven't kind of sussed that out. But Donald's point around the health inequalities is actually really important, because it's about the environment, what you're eating, what your nutrition's like, what your living conditions are like. You know, I work in Windsor, but actually that's very close to Slough. We've got a lot of multi-generational households in Slough where people live very closely together, and that we know that during the pandemic, the COVID, because of those close living quarters, meant that people in those socioeconomic groups actually were more adversely affected quicker in those households. And then multi-morbidity of the diseases that we have, like diabetes, which can also be kind of a feature of some populations. So some of the Asian populations, for example, have much higher incidences of diabetes. We know that those people were affected much more than others. So one of the reasons why the vaccination programme, the NHS has actually supported the vaccination programme, is to try and target some of these groups in a way that we have the knowledge of, where people are, what conditions they live with, and tailor that vaccination programme to their conditions and to their way of living. The homeless, for example, and other people as well. So the vaccination programme has taken that into account, rather than have a mass vaccination programme, which is just the So hopefully that backs up, but we don't know exactly whether it's a mixture of biological and environmental, I think, and I think, Donald, we're still going to have some learning around that for the future.
That's great. Thank you so much. I think we're just getting to the end now. I'm just going to ask one more question, and I think the question will be, what is the COVID? So some people have said that they get sick after, or that they feel sick after having the COVID and flu vaccination. Can you tell us a little bit more about those people who are having concerns about being infected after taking the flu vaccine at the same time as the COVID booster?
Good answer that, and I mentioned this, and then Adrian can comment. I think maybe those that have been involved in the vaccination program scientifically haven't really explained this, in the sense that if you get vaccinated, it doesn't mean you won't get sick. And I think maybe the idea is of how it's presented, and like we think with all medicines, we think once we take them, that's it. It will prevent us getting sick. What vaccines will do, it will train your immune system so that when you encounter the virus or the germ, it will then be removed as quickly as possible. So that means you could get infected. Vaccines won't stop you from getting infected. What vaccines will do, it will hopefully mean that the severity of disease will be less. And I suspect that information hasn't really been sort of provided well, because what that does, and I can see why there is then that odd phrase when you say, I've taken the vaccine, but I'm still sick. And therefore people think, well, the vaccine hasn't worked. But what it does do, and I ask my colleagues, because I've seen data where, you know, with vaccination, hospital transmission has been reduced, etc. So from a vaccinologist point of view, that it's doing what it's supposed to do.
I couldn't agree. I mean, I think it's giving you a form of protection, but it's not a 100% protection that it's giving you, but it's giving you protection against serious illness and serious disease, and ending up with ventilation and all the other support things that are in hospital. And Donald, we with the flu vaccine, for example, we've been living with flu for many years. There are times when the flu vaccine has been less effective one year than the previous year. We don't get it right all of the time, but we do, as best we can with the tools that we've got to be able to give people the protection. But undoubtedly, vaccination has saved lives, and that's what we can hang on to. And we know that it does save lives, and there's the evidence to show that it saves lives, many lives actually.
No, you're right, Adrian. I mean, COVID is relatively new, but I'm sure people on this platform will know what flu's like. And with the intervention of the flu vaccine, particularly amongst our elderly folks, it's been really impactful.
And just to add to what our men have just said, yes, it has been. And Dr. Adrian have said it eloquently in terms of the flu and the whooping, obviously wearing the hat of a midwife here. Been a midwife for over 2 decades. We've always, encouraged our women, pregnant women, to get this year in, year out. And that is just the norm across the board. And in addition to COVID, with all the health inequalities that Donald mentioned, I think it is very important that we have all that information at hand, because what you don't know, you don't know. But what you know cannot hurt you. So it is important to know that as Black women, as Black community, we are at risk of those, health inequalities, as well as those medical risks that we suffered, diabetes, obesity, blood pressure. And I think it's about being self-aware and making sure that you look after ourselves. And also, let's connect early. I think it is important we connect early with the services, especially if you are planning to get pregnant. get all the necessary information, you know, to be able to educate yourself, to be able to get that informed choice, the informed decision, get a midwife along the journey that will educate you. There's so much when you're trying to start having a family, you know, it's not just about being pregnant alone. It's about what do I need to do to safeguard myself as well as my unborn child.
No, most definitely. And I would echo that. It's about being informed, and this is what it's about today, to make the right, you know, the choice that's best for you. Sorry, I know I did say that was going to be the last question, but I've been asked to answer this one last question, and it will be the last question. So why should we be vaccinated even if we've had COVID? So this is a big question that's been asked. So we've had COVID. I believe, you know, I don't need to have a vaccine. What would be your advice to that person?
I'll comment briefly, and then Adrian. So there's a couple of reasons. One, we know sometimes when folks get COVID, the response they get will vary, and that's what we're starting to see. We're starting to see a picture. And again, one of the problems is we're trying to understand this as we go along. And I think science is always viewed as we know everything, and sadly we don't. We're learning this as we go along. So studies have shown that there's some people who make really good response, but there are others who make really weak response or be asymptomatic. Then that's a problem. Your immune system has not really been triggered. So you may get the disease and it may be a problem. And so that's one of the reasons why vaccination, but also what natural infection can do. And this is a real problem. And I suggest folks do look at the studies from a really good friend of mine, Professor Danny Altman, and it's about long COVID. Long COVID is now over 2 million plus in the UK, where you get infected, okay, you survive, but then it's long drawn out. And that's really becoming a problem. I would urge people to really consider the impact of saying, all right, I'm just going to get naturally infected, because the situation with long COVID is really becoming a major problem.
Yeah, and I mean, I just Donald, the points you made earlier about this is a changing virus. It's not like the tetanus vaccine, which just stays the same, you know, and you give lifelong immunity. This is a virus which, like, you know, like Jacob with the coat of many colours, is kind of changing all the time. It's actually, changing very quickly sometimes and going from one country to another. So we have to be on the guard all the time. So the fact that you've had COVID and you've got some immunity from that will wane. You need to kind of get your vaccination schedule at the next, you know, you shouldn't have it straight away after having COVID. You give yourself kind of the time and then get back onto the vaccination schedule to keep yourself protected, because it is like the flu. This is going to be, we're going to move at some stage, Donald, from a pandemic to an endemic situation. And at that, we're going to have flu and COVID vaccination, you know, going forward to protect ourselves. And it's going to be that kind of virus, I think, you know, going forward.
More than likely.
Amazing. Thank you so much. Thank you to all of our wonderful speakers. Thank you to NHS England for collaborating with Black Women in Care today. I found it a really informative session. I am vaccinated and boosted, but you know, there's always, every day is a school day. So please do take away from today's session. We will provide some resources after the session, including frequent questions and answers. Please share them with your colleagues, friends, family. Do get in touch if you have any further questions that the panel haven't picked up on today. We will be running a WhatsApp Q&A session next week at some point, so we will be announcing that at a later date, hopefully by the end of this week. We've just got to confirm. You can also drop us an email at Black Women in Care, so info@blackwomeninCare.com. Olinka, our founder, will put that email address in the chat box, and we'll be more than happy to forward on any questions to NHS England, to Adrian, Donald, or Wendy.
Yeah.
So that's So anything else that anybody else wants to say before I close today's session? I know we've run over a little bit, so thank you so much. I know you're all very, very busy, but I've enjoyed today, and hopefully we'll have a wonderful WhatsApp Q&A next week. So thank you all for joining today's session.
All right, everyone. Thank you very much, and take care.
Yeah.
All right. Bye.
Keep it
Thank
up.
you.
Thanks a lot. Bye.
Thank you, everyone.